Hello, my name is Juan Ramirez. I'm going to be doing a video on post-operative teaching. Knock, knock. Hi there, my name is Juan. I'm going to be your nurse today. I'm going to be going over some teaching about post-operative teaching. Is that okay? All right. I'm going to perform hand hygiene. All right. Verify your name. John Smith. Okay, correct. Date of birth. 2251. Okay, correct. So we're going to start with diaphragm breathing, okay? So this breathing is going to help you straighten the muscle of your diaphragm muscle. It's going to help you decrease your breathing rate. It's also going to help you to alleviate the force of your breathing. So what you want to do, you want to be laying down in a supine position, or you could be sitting up or standing up. So when you breathe, you want to see your belly rise. You don't want to see your muscle or your chest rise, because that would be working your muscle in the upper chest. You want to see your belly rise. So a good way to do this would be to put a hand on your chest, a hand in your belly, and you will breathe and you will see your hand and your belly rise. Okay? Here we go. And you want to do this exercise for 3 to 5 minutes, okay? And that would be your diaphragm breathing. Now I'm going to go ahead and teach you about this piece. It would be incentive spirometer, and you would go and set it up or get it out of the bag and connect this pipe here, and this is how you set it up, okay? And then the therapist will go ahead and set up how much amount you're supposed to reach, okay? You would be doing this exercise 10 times in an hour. So a way to do it would be do it every time there's a commercial, and that kind of adds up to 10 times an hour. So the purpose of doing this is to maintain healthy lungs, to prevent lungs collapse, to prevent pneumonia, to prevent the bacteria, the mucus buildup in the airway. So this will help your lungs stay healthy and strong. So if you do have COPD, you are able to use this. There's no contradictory against using it if you have COPD. A good read for this would be 80% or greater. Using the incentive spirometer, this would measure the vital capacity of your lungs, how much they're able to hold. And the measurement capacity that a lung can hold is 6 liters of air. So this will be in your lungs. So this device, like I said, the respiratory therapist or your doctor will give it to you, and they will manage how much they're gonna put you to practice to reach by using like a scale. They will put your height and your age, and this will tell them how much to do. So you wanna, like I said, connect this piece, and you wanna sit at the edge of the bed or the chair, and you wanna sit up straight. You wanna hold it with both of your arms, and you wanna put your lips around the mouthpiece. You wanna do this, and you wanna suck on it like you're sucking in a straw, and you wanna follow this guideline. You wanna stay the ball. You wanna keep the ball in the happy face. You don't wanna go below or above, and you want to reach your goal, maintaining the happy face, the ball in the happy face, okay? So I'm going to go ahead and demonstrate. So you're going to sit straight. You're going to put your lips around the mouthpiece. Mm-hmm. Okay, and this is how you do it. And the effectiveness that this will have in your lungs is going to open up, expand your alveoli and fill them up with air. So that will give them access to more oxygen. The type of patients that you want this to use is patients after surgery, And also patients that have problems with lungs, that have asthma, COPD, they would benefit from using incentive spirometer. And that's teaching for this. Okay, I'm gonna go ahead and put this to the side. Now I'm gonna go ahead and teach you some breathing techniques. We're gonna start with the huff. Okay, so with the huff, you want to sit up straight, and you want to put your chin, you want to tilt it a little bit up. You want to take a deep breath, and you want to take about 3/4 of a breath, and you want to hold it for 2 to 3 seconds, and then you want to slowly, forcefully exhale, and when you exhale, you're gonna make a sound, and this will help to clear the mucus from the small to the large airway tract. It will move the secretions and the mucus build up from the airway, making it easier to clear. Okay, so I'm gonna go ahead and practice, show you. Okay, so you wanna do this 2 more times. And you would do it another time, and then after that you would do it a cycle of 4 to 5 times, and this will help you clear up anything that you have built up there. Okay, and that's a huff coffee. Now I'm going to show you the control cuff. So for control cuff, you're going to go ahead and sit up straight at the edge of the chair. You want to put both of your feet on the floor. You want to maintain both of the feet on the floor. That's why you got to sit at the edge or in the chair. And then you're going to lean a little bit forward, and then you're going to breathe through your nose. So you're going to inhale through your nose and breathe forward, and then you're going to go ahead and put your hands above your belly. As you exhale, you're going to lean more forward. Exhale, and then you're going to cough 2 times. Okay, so I'm going to show you. You're going to have your feet on the floor. You're going to breathe through your nose. And that's how you do a controlled breathing. Okay, now I'm going to go ahead and talk to you about churning. Okay, so when we do churning, the reason that we churn the patient is because it helps to prevent skin ulcers. Also, it helps to prevent, to keep the pain off, and to keep you comfortable, and also to maintain GI tract promotion. Okay, so I'm gonna go ahead and lean you down to help you churn. So you want to churn the patient every 2 hours. If the patient is dying, they're probably going to be in comfort care. So usually they churn them once a shift, or whatever the family chooses, or if the doctor recommends what to churn the patient while they're in comfort care if they're dying. So you're going to have the patient laying down, and they're going to have a sheet underneath, and then we're going to pull this my way to help the patient come closer. That way he has room to churn. So then we're going to go ahead and churn the patient over. So we'll have the patient churn. We're going to have a pillow on his head. We're going to put a pillow right here. We're going to put a pillow on his foot. 2 pillows on the foot, 2 pillows on the head, and then a pillow here on the arm, and a pillow here. Okay? And that's how you would churn the patient. Bring him back. If the patient has a stroke, you could turn them to the affected side or unaffected side. You just have to use the pillows differently. So if you're going to turn them to the affected side, so he would have the stroke here. So like again, you will pull him towards me, make room so he could turn, and it would be the same way. You will put a pillow here, 2 pillows there, 1 pillow here, and a pillow here, and then this is a free arm. This is the one unaffected. So you would leave it there so it could reach and be move freely, okay? So now he has a stroke, you're gonna also turn him to the unaffected side. So I would go around, I will pull him towards that, so he has room here, and then turn him this way. I would put 2 pillows on the head, and then this is a stroke side, so you would put 2 pillows on the leg too, and then the difference that you would put 2 pillows on the stroke arm, that way it can rest there. So you would put 2 pillows there, and that's how you turn the patient. And you want to do this to help them promote blood circulation, to help the lungs expand. That's why we keep churning them. Another reason why. So now I'm going to go ahead and work on the legs. I'm going to give him some teaching. So I'm going to have the patient bend both of his legs. We're going to bend up in the air, and we're going to hold them for 2 to 3 seconds. And now after that, you're going to lower one leg down, lower the other leg down, and we're going to do this about 5 to 10 times in an hour while he's awake. So bring him back up, lower one leg, lower the other leg, do it again, up, lower one leg, lower the other leg. This will help the blood circulation. So that we'll do that for that. Now we're going to go ahead and work on the toes. So the toes, we're going to go ahead and extend them. Only the toes. We're going to go ahead and extend them down towards the bed. And you're going to be doing the plantar flexion. So we're going to go ahead and only the toes, extend them downwards. And that would be a plantar flexion, okay? And now the toes, we're going to flex them up towards the bed, or the head of the bed. We're going to flex them up. And that will be doing the dorsiflexion, okay? So the toes, we're going to flex them up towards the bed, and that will create the dorsiflexion, okay? And you would do that 5 times in an hour for as long as you're awake, and that also helps promote blood flow, okay? So we're going to do that, and now we're going to go ahead and extend and flex the foot. So we'll do the whole foot. So we're going to go ahead and extend, and we're going to go ahead and flex. Extend and flex. The other one, we only do the toes. Now we do the whole foot. So we're going to go ahead and extend and flex. Extend and flex. Extend and flex. And we would do that about 10 times in an hour while they're awake, and this is going to help promote blood circulation. So now we're going to work on the ankle. So we're going to grab the ankle, and we're going to do circle motions to the right. Circle motions, okay? And then we're going to go to the left. We're going to do circle motions to the left, the ankle. We're going to be doing circle. Then we're going to get the other one. We're going to go to the right and circle motions. Circle. And then the other one, we're going to go circle motions. Okay? Then we do both feet. We will do that about 10 times in an hour to help with blood circulation while they're awake, and that will help them have blood circulation. Okay? All right. Do you have any questions? Anything I can help you with right now? No? Okay, I'll check on you in a while. Go ahead and perform hand hygiene. And I'm done.